Hi, everyone. Thank you for joining for our 2025 Immune Health Talk. So my name is Dr. Tanya Lee, a naturopathic doctor, and I focus my practice on improving immune health. I work with conditions that involve the immune system. So I see a lot of eczema, allergies, asthma patients, as well as a whole plethora of autoimmune conditions. So I just wanted to make a webinar that helps parents and people in general just really improve their resilience against infections. And a lot of people don't know there are a lot of really simple steps you could take in order to really improve your response to to infections. And this webinar is just really here to kind of give you tips and tricks to really catch things before they turn bad. I am going to note that there is no treatment advice specifically given in this webinar. We're not supposed to be treating patients through these platforms. In that if you do like this information and you like to work with an ND, we have several NDs that could help with immune health in my office. My practice is quite full, and so if you'd like to work with me, there is a wait list. And I usually just reserve new patients to more complex disorders like autoimmunity and atopy, like asthma, allergies, and eczema. So if you do have any of those conditions, then you'll be more likely to get on my wait list. Okay. But other than that, if you're just looking for some basic cold and flu support, any of the NDs at our office should be able to help you with that. So I'm just going to get started here. So the agenda for today, it's a 30-minute presentation, and then we'll have a bit of time for questions at the end. That won't be recorded, but this section will. So we could always access the webinar through our website. The link is in the email that you received today. All right, so we're going to just talk about I have a general overview of the immune system. We'll talk about why it's important to support the immune system. Then we'll get into prevention strategies for infections, and then we'll go through some treatment options for so really nice, like at home, easy things that you could do in order to get through an infection more optimally, or I guess there's no optimal way to get through infection, but with the least amount of harm. Let's just say that. So the immune system is very complex. This is not going to be a lecture on the immune system. It's just there's whole degrees devoted to understanding the immune system, but I'm just going to break it down in the context of infection. So we have two arms of the immune system that's involved with infection. The innate immune system is kind of that first line of defense. So it's basically what gets activated when your body detects the virus. And this system is actually responsible for most of the symptoms you'll experience during an infection. And it is a system that often is involved with fevers. This system, like I said, is the first line of defense, but it does serve as an activator towards what we call our adaptive immunity. So this is the part of the immune system that has to learn how to fight an infection. So the immune system sets the adaptive immune system up to start fighting. The adaptive immune system aids the innate immune system to kill the virus, but it also has a different arm that creates memory. So if I have the chicken pox, my adaptive immune system will remember how to fight it so that if I were to be exposed again, I might have immunity, which, the vaccine or getting an infection could elicit actual protection lifelong against having another outbreak. But if it's something more like the common cold, we'll get sick again, yes, but our immune system will be more efficient at fighting it off the second time or the third time you get it. Okay. So we're just going to talk a little bit more about viral infections, just because this is the most common type of infection you're going to get when it comes to respiratory, like seasonal infections. So, typically the first few days that you're exposed, there are no symptoms. That's what makes viral infections a bit insidious, that you could be walking around with being infected, but you don't know. And depending on the virus, that incubation time could be anywhere from a day to 14 days. The first signs that people typically get with infections are like little signs that don't even you might not even bat an eye thinking that you might be sick, but and this is really important because learning these first signs actually gives you the biggest tool to fight or prevent an infection. So for a lot of people, it's going to be that scratchy throat. It may not be a sore throat. It could just be like you might think, oh, maybe I just talked a lot today. Any like if that's the case, still treat it, because the best thing is even if it's nothing, if it there's no harm in treating it. And if it is something, you may have just knocked out something that could have turned into a big infection. Other first signs are feeling tired. And again, that could be multifactorial. So again, it's not the most obvious sign that you might be getting sick. Usually when you start feeling the headache and the joint pains following, that's usually a sign, okay, maybe I am getting sick. And then shortly after that, you might start developing signs of systemic infection. So fevers, this is where everything really kicks in. So it could be body aches, headaches, chills, fatigue, cough, congestion, usually start up in this stage. And then pain, especially if it's an organ specific infection. So it could be sinus pain, ear pain, lung pain, just depends on where it is. And then after the fever breaks, the fever breaking represents that the innate immune system's pretty much done its job. The viral load is done, and now we're in recovery phase. So fevers usually last from anywhere from 1 to 3 days. And then once that breaks, we're typically in recovery phase. And so recovery phase is when your body's trying to get rid of all the inflammation that virus basically brought up. So in this phase, you're going to get a lot of mucus production because everything's just coming out. Your body's just trying to expel all the debris that the infection caused. You may have, again, any method to get congestion out. So you'll have a cough if ever all the congestion's in your lungs. You might have lots of sinus stuff if it was a sinus infection. This is a really important phase because your immune system is actually on the lower end here and it's meant for recovery. So this is actually a really vulnerable phase that if you're exposed to another infection, whether it be bacterial or viral, you're more prone to getting sick in this phase. So it is really important that you still protect yourself, make sure that you're fully recovered before you go out and do anything that might expose you to other infections. Once the recovery phase is done, then you're good. And then in between, it's really about prevention. Okay. So yeah, the most common infections you're going to encounter as just from like a general perspective is going to be viral infections. Those are majority of our respiratory infections. It's very rare to contract bacterial infections through airborne sources. A lot of the time, bacterial infections are more with direct contact. And again, it's not that common that you just get a bacterial infection. Usually what will happen is you'll have a viral infection that weakens the immune system, and then whatever bacteria that has the opportunity to invade, it will. And these bacterial infections could be bacteria that you're exposed to that you don't normally encounter, or it could actually be infections that live within us. Like, a really common one is strep. When our body is fighting the flu, if we do have a bit of strep overgrowth within our microbiome, like it may take that opportunity to start infecting like the tissues. So that's where you could get maybe a sort of strep throat or an ear infection for a different type of bacteria. So, it's not that straightforward, but these are typically the types of infections that you're going to encounter during the cold and flu season. So really what we're trying to do when we're trying to improve immunity is basically improve inefficient or imbalanced immunity. No one really has like immunodeficiency unless you actually are on medications or have a very specific disease that causes immunodeficiency. I like to use the word inefficiency because that's really what it comes down to. And there are really a lot of different reasons why someone can have inefficient immunity. Some health conditions associated with this could be, again, having like immune system disorders like atopy, autoimmune disease, being on medications that cause immunosuppression. But a lot of the times, typical reasons for inefficient immune system is actually nutrient deficiencies. So vitamin D, zinc, vitamin C, vitamin A, these are common nutrients that would be within their deficiency would create an inefficient immune response. So signs that you might have an inefficient immune system are things like frequent infections. So I would consider frequent infections being sick more than one time every 2 months, or having like a recurrent infection. Like I constantly get urinary tract infections, or I constantly get sinus infections, or or anytime someone is even an inkling of sick, I seem to catch it. Like, these are really strong signs of inefficient immune system. So another sign could be you just never really felt like you recovered from that infection, and we see that with long COVID. If we want to be topical here, prolonged fever, so that usually indicates that your body's really struggling figuring out how to get rid of an infection. So anything that is beyond 72 hours, I get a little bit worried if someone's not able to resolve an infection or a fever before that. Long recovery time. So it's like you fever, you get through that and you get into recovery, but it takes you like 2 months for that cough to resolve. I think a lot of people lovingly like to call it the 100-day cough. I always tell my patients, you don't need to wait 100 days for that cough to resolve if you know kind of how to support that system. And then another big sign would be that every time you get sick with a viral infection, like a common cold, all of a sudden you have an ear infection or you get another throat infection. So you're prone to developing secondary infections when you get sick. So if you have anything like that, this talk could be really helpful for you. In terms of why it's important of having a healthy immune system, learning how to manage infections could lead to reduced severity of symptoms, reduced duration of infection, and prevent the activation of certain autoimmune diseases if you're genetically prone. So what that means is that if I constantly am activating my innate immune system and constantly triggering inflammation on a regular basis, if I'm genetically prone to have an imbalance or inefficient immune system, that could potentially lead to me to developing that level of disease. So I know, again, this is a very loaded topic. However, that is a very true thing. A lot of patients' autoimmune diseases are activated after being sick, or after having a certain viral infection, or after having a certain vaccination. And again, it doesn't mean that these things are bad or we shouldn't have them, but in genetically prone people, we need to be aware that overstimulating the inflammatory system could potentially push someone into that disease category. So it's just something to think about. It's not a hard, fast and rule. It doesn't mean that every time you get sick, you're going to develop an autoimmune disease. That is not what I'm saying. I'm just saying that there are certainly genetically prone people that could happen to. You could also, immune system is very much involved in every system in our body. So just having a balanced immune system is going to improve just overall well-being, and if you do have issues around like metabolic health, hormonal health, balancing the immune system can actually have favorable impacts in these systems as well. So prevention strategies. So honestly, I always just say to patients, like, the best way to treat an infection is just to prevent them. So if you work with an ND, very specifically, we could help you identify maybe certain health symptoms that could indicate that your immune system is imbalanced. So I do strongly suggest that if you don't have an ND that you're working with, that, we have people here that you could help. You don't also have to come to us. You can see other people, but obviously I'm going to always recommend that you come to our clinic because we could identify weaknesses in systems that could lead to the reasons why you might be getting sick all the time. And we need to correct those things, because everything I talk about in this talk is assuming that you have a strong balance system in general, and that these are just extra steps you could do. One of the important things I like to highlight here is that if you have any chronic digestive health issues, it's very important to resolve those if you want to have balanced immunity, because your digestive system, or your colon, is the largest immune organ that we have in our body. And it's also where a lot of our microbiome lives, the majority of our microbiome lives, and the microbiome plays a big impact on the balance of your immune system as well. So how do I keep my immune system stable? Well, the basics here are to have a healthy lifestyle. Make sure your diet's rich in micronutrients, low in inflammatory foods, maintain healthy sleep-wake patterns, strong, steady digestive patterns, trying to keep antibiotic usage to a minimum. And again, these are all things that NDs can help you with. And when I say NDs, I mean naturopathic doctors, if that wasn't given. Regular exercise and movement routine, stress management, sunlight making sure that your vitamin D status is strong, especially in Canada, because a lot of us are walking around with deficiencies and not knowing it. The sunlight in Canada is not typically strong enough to help improve, to keep vitamin D levels strong throughout the year. So supplementation is very important in the Northern Hemisphere. So key nutrients that we really want to think about when we're trying to support a healthy immune response are zinc, vitamin C, vitamin D, and vitamin A. I suggest that you go to the Health Canada website and look up the recommended daily allowances. So RDAs are basically the minimum amount of each nutrient you need to prevent deficiencies. So the first goal is to get your RDA. Then you start supplementing on top of that for optimal ranges. But why I'm saying this is because a lot of people want to start with really high numbers and supplements. But at the same time, while I agree that a lot of these nutrients probably require more dosing when it comes to supporting the immune system, if you're not even getting the bare minimum, that's what I want you to work on. Okay. And just whatever you can't get through diet, you could supplement through supplementation. And again, I'm not going to go through dosing because I'm not treating you. I'm just giving this information for you so you could talk to your ND or your medical doctor about dosing. Okay, so just going back to that, zinc is a really hard nutrient to get, especially if you're vegan or vegetarian, because if you look at the sources, they're highly based in meat, red meats, and seafoods. Some vegetarian vegan foods contain zinc, but you're probably not going to be able to eat enough to hit your RDAs in a day. But you could challenge me on that. Like, you could try it. Vitamin C is very easy to get. People usually don't suffer from vitamin C deficiency because it's just so abundant in our vegetables and fruit. And these are just like the top foods that contain high vitamin C. Vitamin D is difficult to get just through food and just through sunlight. It's something that we often need to supplement if we're living in Canada. But some options for food sources would be fortified dairy products or non-dairy like non-dairy substitutes, fatty fish, liver, egg yolk, and mushrooms. And vitamin A, beta carotene is really easy to get because beta carotene is actually a version of vitamin A. So you're going to get that through orange and yellow colored fruits and vegetables. However, that beta carotene needs to be converted into active retinol vitamin A. And some people don't have the genetic capacity to efficiently convert beta carotene to active vitamin A. And if that's the case, you need to get more retinol sources of vitamin A. And that's harder to get because majority of that's going to come from liver, and not everyone's willing to eat liver. So again, supplementation could be an option, but that's something you definitely need to talk to a healthcare professional about because there is the risk for vitamin A toxicity. So if you are going to supplement vitamin A in its retinol form, you need to talk to your healthcare provider about that first. I do not recommend just dosing it on your own. Again, prevention strategies. What do I take every day to help to keep my immune system strong? Vitamin C, zinc, vitamin D levels should be tested if you're going to supplement vitamin D to ensure accurate dosing. Other supplements outside of just single nutrients, cod liver oil contains both natural vitamin A and D, and oftentimes you don't need to test for that because it's a standardized dose within that cod liver oil and it's not very high. So again, talk to your healthcare provider about dosing, but it's generally pretty safe for any person as long as you're not supplementing vitamin A in its retinol form in other ways, okay? And then probiotics are also been clinically shown to reduce severity and duration of cold and flu. They may not be that helpful if you don't have any digestive issues, but if you do, then a probiotic could be very helpful in this situation. And if you ever want to delve into herbs, herbal formulas that contain astragalus, so astragalus herb, will be a really good supplement to use in between getting sick, as well as colostrum. And again, dosing should be recommended by your healthcare provider. So treatment strategies. So the first signs that you are getting sick are really important. So if you have a scratchy throat, even if you think, oh, maybe I just talked a lot today, just start treating it. And we're just going to talk about what those treatments are that you could do right away. So my favorite go-to is using topical throat gargles or sprays. So over-the-counter throat gargle like betadine. It's not really naturopathic. I mean, it kind of is because it's iodine, but you could get it from Shoppers Drug Mart. It's over the counter. The first signs you get sick, even if you don't know if you're sick, just give it a gargle because chances are, if it is an infection, you're going to knock it out like that. If you're not comfortable taking betadine for whatever reason, you could also go with like echinacea-based throat sprays you could get from the health food store. So echinacea and propolis, you'll find them both in throat spray form, and either or is fine. With those, there's no like dosing limitations really, so you could just kind of use them as needed. Whereas with betadine, you just read the instructions on the side. I think with betadine, you can't dose it more than 4 times a day because of the high iodine content. And a side note with betadine, you should not, again, because it's over the counter, but it's because it's high iodine, check with your healthcare provider before using it to make sure it doesn't interact with any medications you might say. But that kind of goes true to everything I say. Just make sure you check with your healthcare provider if you are on taking other medications to make sure there are no interactions. Vitamin C, when you're sick, you could dose up to 5,000 milligrams a day. And again, this is just general information. You need to talk to your healthcare provider before, so don't take this to heart. But these are safe upper limits that I would never really be too concerned about if patients are using them during infection. So you would start these things up the moment you do feel like you're about to get sick. And then hopefully, if you can catch it early enough, it may knock it out before it gets to the fever stage. And then again, herbal formulas that contain echinacea, elderberry, and andrographis are good for active infection, whereas herbal formulas, like what we talked about before, containing astragalus, would be better for in between infections. In terms of other things, so symptom-specific treatment strategies here. Fevers, you would just dose Advil and Tylenol as directed. My personal, not personal, but my professional advice would be that I like dosing. If you're going to kind of pick a time to dose Tylenol or Advil for yourself or your kid, bedtime is the best because it's going to help you sleep through some of that infection because you really need to sleep during infection to really help with recovery. And then some homeopathic, if you don't feel comfortable using Tylenol Advil, or if the fever is just not high enough to use that, because we don't really use Tylenol Advil unless that person has a very high fever or is very uncomfortable, you could go with naturopathic recommendations. So a lot of the most common things that you will find for fevers over the counter you at natural health foods would be homeopathic remedies that contain belladonna. I find these very effective and very quick acting. And again, for very specific dosing recommendations, you would just ask your healthcare provider for that. And they're homeopathic, they're not herbal. So belladonna, from a herbal perspective, is considered toxic, but not in homeopathic form. So I just want to create that nuance there. I'm homeopathic, not herbal belladonna. For ear infections, there are, again, at health food stores, you could get mullein and garlic ear based ear oil to apply directly to the ear, especially if that ear infection has not kind of developed into a systemic infection. And then same goes with sinus and lung infections. There are specific organ specific treatments. So nasal rinses. You could go to the shoppers and just get like saline solutions, steam inhalations. I have a handout that we could refer to very shortly about that. N-acetylcysteine is a common nutrient we use for lung infections. And again, if you go to the health food store, a lot of these lines do contain specific sinus and lung infection formulas, or you could talk to your naturopath or healthcare provider about specific recommendations in this stage, okay? So at home remedies, I'm a big fan of at home remedies, and this is kind of the big takeaway for today. Garlic and honey tea, it does smell, but it works very well. And garlic is an antimicrobial, so is honey. And both of them have been shown clinically to help reduce duration and severity of cold and flu. So no harm in making yourself some garlic and honey tea throughout the infection. And this is just a simple recipe I give to my patients for that. Steam inhalations, another great thing to do for both anything that kind of involves the head, like throat, well, actually everything, even the lungs, because you're inhaling the steam, throat infections, sinus infections, lung infections. You could just use straight up steam from water, or you could add a couple of essential oils to it if there's a major infection. But these are the instructions there. So you could always refer to this if you're looking to do a steam inhalation. I feel like this makes a huge difference in my, like when I get sick. And if I add the steam inhalation, I just feel like everything just gets better a lot quicker. And this is something I've just more recently started doing amongst everything else I do. And I have felt that it kind of like improved my recovery time by a day or two. So it's easy, it's free. Everyone has this stuff at home. I don't want to make assumptions, but most people have this stuff at home. And these are the instructions I recommend that you have access to this presentation afterwards, and that you could get these instructions. And the last thing I really love are the wet socks. These are great. They're great for kids. That I have a handout. It was just the instructions were way too long to put on one slide. So you could just copy and paste this link. We have a handout in our website. The whole purpose of warming socks is just to pull congestion from the head, reduce fevers. I find that the moment you feel like you're getting sick, if you do a warming sock treatment, a lot of the times, again, it's going to just knock out the infection before it gets bad. So again, of course, there's always that one sneaky infection that no matter what you do, it still just manages to get in, and that's okay. If you get sick, even with doing the prevention strategies, if you still get sick, it's still worth doing this stuff because it's going to reduce the severity of symptoms and reduce the duration of illness. So nothing is done in vain. All these strategies work really well. Sometimes you could do it and you never get sick. And then sometimes you do it and you still get sick, but you don't feel as sick as you would if you weren't doing it. So I hope this talk was informative for everyone and that you feel like you've gotten a lot of really good education around it. So I'm going to stop the recording here and I'm going to open up the floor for questions. Thank you.